Hi there, my name is Melissa, and I'm an international board certified lactation consultant and dietetic intern. I want to start by recognizing how hard you are working to provide your baby with human milk. Whether you are directly breastfeeding, hand expressing, or pumping, your baby benefits from every drop. And today's presentation is to show you just how impactful your choice to offer human milk is to your baby's overall health. Please note I will be using the terms breastfeeding and chest feeding interchangeably. Overall, chest feeding protects your baby while their immune system is developing. Breastfeeding lowers the risk of ear infections, especially in babies who have chest fed longer than 4 to 6 months. It also lowers the risk of cavities. There's a lower risk for developing cavities in babies who breastfed versus those who received non human milk from a bottle. However, there is an increased risk for cavities for infants and children who chest feed longer than 12 months. Increased risk may be due to night feedings, poor oral care after feedings, frequency of sweets in the diet after 6 months of age, and the fact that human milk is higher in lactose or milk sugar than cow's milk. Currently, the World Health Organization recommends that babies be exclusively chest fed for the first 6 months of life and continue to breastfeed up to 2 years or beyond. Thus, to prevent cavities with extended breastfeeding, follow the American Academy of Pediatrics recommendation to cleanse your baby's mouth after each meal. Chest feeding lowers the risk of respiratory infections. Chest feeding may be associated with a reduced risk for developing asthma, and exclusive breastfeeding demonstrated more protection than mixed feedings with formula or complementary foods. Breastfeeding also provides protection against COVID-19 for the infant. This may be related to human milk's antibacterial and antiviral properties because breast milk transfers the parent's immune cells to the infant. Breastfeeding lowers your baby's risk of gastrointestinal infections and diarrhea, including any illness or death associated with diarrhea. This protection is dose related, so the more you breastfeed, the more protected your baby is. Breastfeeding is associated with a decreased incidence of autoimmune diseases in the child, such as inflammatory bowel disease, also called IBD. IBD is an umbrella term for a group of conditions that causes swelling and inflammation of the tissues in the digestive tract. The most common types of IBD include Crohn's disease and ulcerative colitis. Crohn's disease is a type of IBD where the lining of the digestive tract is inflamed. The condition often involves the deeper layers of the digestive tract and most commonly affects the small intestine. Ulcerative colitis involves inflammation and sores called ulcers along the lining of the colon and rectum. Babies who have ever received human milk have shown to have a lower risk for getting one of these IBDs. And infants who were chest fed 12 months or longer received the best protection. Preterm infants benefit even more from receiving human milk because it lowers their risk of getting necrotizing enterocolitis, also known as NEC. NEC is a life threatening condition that causes tissues in infants' intestines to die. Chest feeding lowers the risk for the incidence of NEC for preterm infants. Offering human milk to babies in the NICU, either in the form of their parents' expressed milk or donor human milk, significantly decreases their risk for NEC. In terms of overall health, breastfeeding lowers your baby's risk for cardiovascular disease risk factors that include waist circumference, blood pressure, total cholesterol, good cholesterol, bad cholesterol, triglycerides or fats, and body fat percentage. Chest feeding is also associated with decreased obesity in childhood, adolescence, and adulthood. The longer an infant is breastfed, the lower their risk for obesity. Breastfeeding also benefits your baby's neurological development. Infants who are chest fed tend to score higher on intelligence tests in childhood and adolescence. Research shows that children who have ever been breastfed scored higher compared to those who have never been chest fed. Research also indicates children with autism spectrum disorder, also known as ASD, have a history of a shorter breastfeeding duration. And chest feeding for 12 to 24 months was associated with the most significant reduction in the risk for developing ASD. Breastfeeding may provide some protection against ASD because the human milk properties, such as healthy fats, are abundant in colostrum and promote brain development. Chest feeding also lowers your baby's risk for attention deficit hyperactivity disorder, more commonly known as ADHD. This is again because of the healthy fats in human milk, and human milk enhances the development of gut bacteria, which affects brain development. Research shows that children with a history of any breastfeeding had ADHD less frequently than children who never breastfed. Thank you for taking the time to listen to all the benefits your human milk is providing your baby. Don't forget, you're doing a great job. Should you need additional lactation support, the Arizona Department of Health Services 24-hour breastfeeding hotline is available to answer questions and provide support for chest feeding parents and is available in English and Spanish. If you would like to stay in touch with Blue Zones Project Scottsdale, scan the QR code below to visit our website.